Welcome back, everyone, to part 4 of Dental Health with Sister Camille.
Pause for me. Good morning, everyone. I thank you so much for being on with us this morning. I thank you for your patience. Now, because of the timing that we have, I'm just going to jump right in. And I'm going to start with a pop quiz. And this is really for everybody, simply because we have gone at least 2 weeks before I can get to do this part 4. But I thank God for it, and all my praise and honor goes to him. So I'm going to start with a pop quiz. The purpose of the pop quiz is just to refresh your memory. And for those who were not here for the first, second, or the third part, we'll get a little bit of an idea as to what we have been discussing and how we actually went through discussing these things. It's not a long one because I only have one more disease that I need to connect the oral health to, which is a very important one. And then I want to talk about something that came up as I was updating my PowerPoint, because every time I'm finished, I update the PowerPoint to make sure that the presentation is even more clear for everyone. So the first question that I have for everyone is this, and you can pretty much either raise your hand or type in your answer, because it's usually just 1 or 2 words responses, okay? So the first question is this for this pop quiz. Complete this phrase. A practical knowledge of the science of the human life or the human body is necessary in order to glorify God in our bodies. It is therefore of the highest importance that among the studies selected for childhood, physiology should occupy. I'm looking at the chat. It should occupy what? Just fill in the blank. It's 2 words. That's right. First place. That's absolutely correct. It should occupy first place. We should take the time out to teach our children how our bodies function. And then she adds to this that hygiene should be added to that. So as you're teaching your children, whether you're homeschooling or they're in school, even as a young child, they should start learning about their bodies. Now, because this is a dental presentation, it is definitely going to focus on them learning how to keep their mouths clean, not just their teeth, their whole entire mouth. The next question is this. What is this a picture of? It's just 2 words. Anybody? What is this a picture of? Okay, it is actually a picture of the tooth anatomy. Now, even though this is of the tooth and its surrounding structures, we went through all of this in the first presentation. I would encourage everyone to be familiar with the entire mouth anatomy. Okay, this would include your tongue and its function, your salivary glands, where they are located and what type of saliva they produce. It is very important that we understand these things. And the overall tissue called the mucosa in the mouth. Those are the soft tissue or the inside of your lips. Know what their functions are and what they should look like in a state of health so that you can know when they are not in a state of health, even if they are not in pain. Okay, so for example, the appearance of the attached gingiva. I asked a question if there was like black marks on the tooth, if there was black marks on the gums, rather, if that was a disease. And some people actually thought that the person has a disease. Well, it's just pigmentation. Just like we have different complexion, the gums has pigmentation that makes it darker in some areas. And you usually find this in Mediterranean people and Black people. Okay, so it's not always pink. Okay, so just keep that in mind. Another thing I want you to pay really close attention to is not just the anatomy on the back picture, but I want you to pay attention I don't know if you can see my arrow, but if you look on the anatomy picture where it says enamel, you see these dark lines, okay, on them. And when you look in the area that's a little bit yellow or peach, it's you have those dark lines. And then right in the center where it says the pulp, you have your blood vessels, which is your nerves, your veins, your arteries, as well as your nerves. Now, these lines that you see in the enamel and the dentin are called dental tubules, okay? On the picture below it, you have fluid-filled tubules. These are called dental tubules. These are vital to understand that they are there. This is how you feel sensation of hot and cold in your teeth. They actually have the shape of like an ice cream cone where it's widest, the opening is widest close towards the pulp chamber, and then it thins out as you go out to the enamel. Like the tip of the cone is where it's the smallest. Okay, so this way you don't really feel a lot of sensation because it was wide open at the enamel. You can eat or drink anything that is remotely warm or even slightly cold. All right, but these are very important, okay, when we talk about something else. But keep that picture in mind, you see it again. The next question is, what is this white substance on the teeth and the instrument called? Anybody?
Plaque.
Yes, it's called plaque, right? It's called dental plaque or biofilm. I know the pastor, for those who are in the training, he actually mentioned biofilm the other day. And this is one of my deepest research. I absolutely love researching these things because it has to do with microbiology. And you see dental film, I mean, not dental film, you see biofilm, you can see it anywhere. It's just an accumulation of bacteria. Now, when you see it in the mouth like this, that tells me, if I look at someone and I can see in their mouth that there's plaque on their teeth, good job, Edith, I saw that. I can tell that they have not brushed their teeth in at least one day. Okay, it can build up fast for more people, you know, but at least one day they have not brushed their teeth or that part of their tooth or teeth. All right. Sister Veronica, when it comes to tartar, is when this plaque actually starts to calcify itself, and that takes about 2 to 3 days of not brushing your teeth. And once it's calcified, where it becomes tartar, or what we call calculus, you cannot remove it at home. It must be professionally removed. Okay, so just keep that in mind. Good job. But this is where a lot of the problem is, because it's a whole lot of bacteria that is causing the problem. The next question is, can being afraid of the dentist affect someone's dental and overall systemic health? Yes or no? Talk to me, everybody. Yes or no? Absolutely, Angela. Yes, it can. Okay. This is why, yes, good job. This is why when any one of us take up this gospel medical missionary work, we must be very familiar with knowing how to properly deal with the mind. We must be patient, long-suffering, and have a true desire to be used by God to affect healing. And healing starts in the mind. We were told by Ellen G. White in Ministry of Healing that 90%, 9 out of 10 diseases starts in the mind. Okay, so when we're dealing with anyone who is sick, whether it's from a dental or systemic perspective, we have to address the mind and be very encouraging. Okay, this may take some time, but when dealing with the mind, we must be very careful not to cause anyone more anxiety to pain as we help them. We can't allow them to become anxious and worried. Okay, recall that this was do you guys remember that this was a picture of the young man who was afraid of dental care, and for over 20 years, okay, he did not brush his teeth because he was afraid of oral care, whether it's at home or going to much less going to the dentist. And this would tell us that this individual may have been traumatized at some point in their lives for them to be afraid to even brush their teeth. This is what his teeth looked like after he had them professionally cleaned under IV sedation. Okay, so yes, what goes on in somebody's mind can actually affect their health. Okay, and we want to make sure that we address that. The next question is, what is this space called? Where you see the arrow, what is that space called? Does anybody remember? Yes. Anybody remember? It's actually called the sulcus. Okay, if you don't remember the word sulcus, it's actually called the pocket. Okay, and so when it is very important to know and understand this space. This is the key. This is the root of where dental diseases start. One of them, the main one actually. This is the connection between oral diseases and systemic diseases. This is where this starts. This is where bacteria mainly gets access, okay, to the bloodstream. So if you're looking at, this is tartar, this thing that is like hard clay, however you want to however you can understand it, it is very calcified, it is hard, okay, and it is a coral reef for other bacteria. Okay, this actually irritates the gums that lay up against the tooth, and that causes ulceration. And now you have all these white blood cells that are coming there. Really, they're called PMN, or polymorphonuclear leukocytes, also known as neutrophils. They actually come to that area and try to fight off the bacteria that is coming in. But these bacteria are coming in full force. So if your gums are bleeding, it must tell you, when you floss or brush, it must tell you that, hey, there is ulceration up against my gums. And if there's bacteria in my mouth, which is always bacteria there, it has direct access to your bloodstream. This is going to cause problems throughout your whole entire body, which may manifest itself in different kind of diseases. And if you have any comorbidities or other kind of diseases, it can really start a serious, horrific game of tag teaming, okay, each other. So this is also where we can see the application of the gospel, okay, in poor oral health being a symbol of sin, and the need for the person who has this invasion, this sin invasion in their bodies, they have to go to someone to get this stuff removed. Just like we who have sin, we cannot clean up sin in and of ourselves. We must go to someone. We must go to Jesus Christ, okay, in order to get the help and the restoration, which has to come from outside of ourselves. So this is key. No matter what work you have, I truly believe that there's a gospel application to any work that anybody's involved in. And so as gospel medical missionaries, we want to be very mindful that God can use us in any capacity and in any area of work that we are in. Okay, so just keep in mind that it is, oh, I didn't put the answer on the screen, huh? It's called the sulcus, or the pocket, or the dental pocket, or the periodontal pocket, okay, when you get a periodontal evaluation. So my next question is this: what is the #1 preventable disease in children? What is the #1? We talked about this quite a bit. So what is the #1? Because children cannot take themselves to the doctor. And this is something that we have to pay attention to. The little ones are those who are mentally challenged or have developmental issues where they cannot communicate as well. So we're going to have to pay attention to this. It's actually called, that's right, the #1, thank you, is dental caries or tooth decay. Okay, children, you will find a lot of children, especially, it doesn't matter what community, but especially in low economic communities where the children are suffering with tooth decay, and the parents cannot seem to understand why that is an issue. Okay, but keep in mind that if there's an infection and it goes into the bloodstream, that child's whole entire physical health is at risk, is compromised. Here you have a child, this is the upper teeth, and the two front teeth are actually decayed or have an infection all the way down to the pulp chamber, right into the center of the tooth. So now that infection has access to that child's bloodstream. Okay? And so we take them to the hospital. This is just a hypothetical situation scenario. If that child is becoming what we call ADHD or whatever, we don't know what is causing that because we're not paying attention to their mouth. And so it's something to look at. It's something that we need to make sure that we assess everything so that we can take care of these little ones or the ones who cannot communicate properly what is going on with them. Okay, the next question is this. True or false? Poor oral health have a negative impact on the overall health of the body. Is that true or is it false?
True.
That is absolutely
True.
true. Definitely. Please keep in mind that cardiovascular disease, which includes many diseases that's associated with the circulatory system. This means that if something is going on and this infection now has access to the bloodstream, it is going to totally affect the cardiovascular system. Okay, so we want to make sure that, I have to put my answer up, huh? Okay. So we have to make sure that we are looking at every aspect of a person. Now, this is not to draw any attention to myself, but a lot of the medical missionary work, I have never heard them talk about dentistry. Yet this is a key part, to a key entrance to the whole entire body. And this is why I am doing this, okay? To God's glory. Okay, so let's move on to the next question. Of the following diseases, which one can a person oral health affect? I absolutely did not edit this. Let me fix this for everybody. Okay. Thank you, everyone. Which one can affect a person's oral health? Anyone? Let me see what you say, what you're saying here. My thoughts exactly. All right, so I see A, cardiovascular. Angela, which one is it? Angela,
All
you
of
pick
them. E, I'm sorry, I made a mistake. All of them.
That's right. Every single one of them. Okay. These are only a few of the diseases that can be directly affected by poor oral health. Now I'm actually gonna go into the last systemic condition that oral diseases can affect. Okay, and we're gonna be, and actually, it's going to be on preterm labor. Okay, now I don't know if you know this, but what goes on in that expecting mother's mouth directly affect that little one. Okay, directly affect that little one. Some of the, unfortunately, poor oral health can have some really devastating effects on that unborn child, even to the point of death. Okay, oral bacteria and chemical mediators will cross the placenta. And some of the chemical mediators that I really want to zero in on, if you do not understand these words, I would do my best to explain them to you, but then you can look them up if you want to. Okay, some of them include the PGE, okay, PGE2, which are called prostaglandins. There's also the interleukin and the tumor necrosis factor, or TNF, and you have numbers that are associated to these. These are the main players in the inflammatory response, okay? Prostaglandin is released by the leukocytes and the mast cells. Leukocytes are your white blood cells. However, when the body reaches a certain level of these chemical mediators, okay, via the bloodstream, and is detected by receptors in the brain, it will actually trigger that mom's body to go into labor. Believe it or not, it will, regardless if the fetus has reached a full term or not. However, for our discussion, it is not a full-term fetus, and this is all caused by the presence of chronic periodontal disease. These are inflammatory responses, okay? Now, when the PGE2 or the prostaglandins reach a certain level, it is going to send a signal. The body is going to send a signal via the blood to the brain, the hypothalamus, and the hypothalamus is going to say, okay, look, we have reached this level, because usually the mom, when she's full term, is going to send forth these PGEs as well. And so the brain's gonna say, okay, it's time for you to go into labor. But if these PGEs are being accumulated at a high level at a very fast rate, because there is gum disease in the mouth, the brain is not going to say, oh, it's just gum disease. I can wait on the baby. I can hold off on the child being born. They just need to get their teeth cleaned or addressed. The body's not going to do that. It's just going to go ahead and say, hey, it's time to go into labor, and that can cause preterm labor. Okay. Okay. So regardless, I just pretty much said that. Is there a question? Okay. Now, when a mom who has gum disease is experiencing or has gum disease, experiencing gum disease, the best time for her to have dental care is during the second trimester. Okay. During this time, there's little chance of interfering with the development of the fetus in the first trimester, because that's where most of the development takes place. The heart and then the nervous system. You can watch amazing videos on how this happens in the female body, and it's something that I actually love to watch and see. But during this time, there's little chance of the interference of developing fetus or running the risk of the patient going into labor during the third trimester. So you want to make sure that you're getting any kind of oral health care. You want to make sure that you do it during the second trimester. And besides, it's also very uncomfortable for that expecting mother to lay back with such a big tummy. Okay. And then after she gets that care, it is up to her now to actually keep up with the good oral hygiene practices. At this point, when that expecting mother goes to the dentist or go to the periodontist, which is a specialist in gum disease, they have to weigh the cost versus the risk. Okay. And so knowing that that child is at risk, more than likely they're going to try in their very utmost way to make sure that they do not allow the body to go into preterm labor while they're in that dental clinic. Okay, so you have to know that they're going to look at certain things, and the discussion of treatment plan will go on between the two. So that's the main thing. In some cases, expecting mothers can also develop what is called a pregnancy tumor. This is not a cancer tumor. It is really just an overgrowth of the gums due to poor oral health or periodontal disease. And this is what it pretty much looks like. Okay, you can see that bulging or more pink area on the attached gums or gingiva. That is what's called a pregnancy tumor. It can be very uncomfortable for her, although it is painless. Okay, it's correctly called a pyrogenic granuloma. That's the actual correct term for it, which is a result of gingival hyperplasia or overgrowth due to the irritating calculus or tartar that is under the gums. It usually forms after the first trimester or after the first 3 months. Give me 1 second. I hear my husband singing, and I don't know if that's interrupting you guys.
Sister Camille, we cannot hear it on this end.
Okay, great. Okay, so in the past, let me show you what they look like here. In the past, it was advised not to remove it because it would lead to a crater after the birth of the child in the gums. But recent studies and research have shown that the use of a laser, a diode laser, can effectively remove it without leaving any type of disfiguration on the gums. Now, that would be up to the mom based on talking with the dentist if she wants to go through and just get that removed. Okay. So this is like a before and after picture using that particular laser to remove it, and there's no crater that's left between the teeth. However, studies have shown that doses of high vitamin C and a diet that mimics fasting, please stay with me here. This is also known as intermittent fasting. We have talked about this during our training. Oh, thank you. We have talked about this during our training, intermittent fasting, which can aid in removing of these tumors naturally. However, keep in mind that if it is caused, and because it is caused by the tartar under the gums, That's the main cause. It can be caused by other things, but there's an irritant there. You know, just like how a clam makes a pearl, there's an irritant that comes into the clam, and because the clam is irritated, it's going to now lay down these materials that really was called the pearl. Okay, it's gonna protect itself by now smoothing over that sand grain and making it into this beautiful, expensive thing, because pearls are expensive, and to protect itself. This is why the 12 gates in heaven has 12 pearls. It's to protect heaven from anything coming in, but the sin will not arise again a second time, according to Nahum 1 and verse 9. So you can actually change the diet, intermittent fasting, increase the vitamin C to help reduce this for someone who comes with this pyogenic granuloma or pregnancy tumor, or they can just simply go and get it removed. That would be their decision. So now that we have gone through, that's it that I have to do with the systemic diseases, because we addressed a whole bunch of them already. However, because of something that came to my attention by 2 people in the space of 3 days, I thought it was important that I add this other information to you because it's vital. So we have gone through a lot with this presentation, but I would be remiss if I did not address this one condition, and that is the infamous root canal. Okay, and then I want to talk about barriers to healthcare. That's only one slide. Now, I know I had mentioned this briefly earlier, but these are some of the issues that many people face when they are having issues with their oral health, all of these diseases. But I really want to focus on this root canal. Okay, so the root canal, what is it? Is it really necessary? Is it safe? How does it really affect the body? And what do I do? Okay, what to do if you are told that you need to have one done? Okay, now I'm gonna do this very slowly because I want to make sure that every single one of us understand what is going on. Okay. Okay, let's take a look at this picture again. Can you all see this picture? I hope you can. Now, I just showed you this picture on the left on your screen, looking at your screen, and on the right, the anatomy of the tooth, the one that says Adam. Okay, you have the anatomy of the tooth. Here, right where you see the line that says pulp, you have the gums here. Okay, that pink line, that's the gums. You see that same pink line on the picture on the left. The gums become irritated because there's a buildup of plaque that turns into tartar, that calcifies into tartar. It irritates the gums, causes ulceration on the side of the gums that rest up against the tooth, and now this gives access to the bacteria into the bloodstream. Okay, now your body, like we have talked about before, literally starts to extract the tooth on its own, because it's going to cause, if you can see that spongy area, I wish I had another picture. Give me a second, let me get to another picture for you guys, okay? So a lot of pictures, but I want to get to this because I really, really need to make sure that you guys understand what is going on. When you look at this picture, you have that tartar or the plaque buildup on the tartar, okay, where you see the arrow is. The gums, the inflamed gum tissue, bone loss. Okay, what your body is actually trying to do is literally extract the tooth on its own. Okay, so when you have this picture, okay, you have the calcified bacteria, you have open wounds on the gums or ulceration, you have the bone. What the body does, it actually starts to extract the tooth on its own, just like you would literally take your shoe off if you have a sand pebble in there. It's irritating. Okay, but that is not the only way that this is the main one, because usually people with periodontal disease, some of them have a very healthy tooth. There's no cavities there. But can cavities affect the bloodstream as well? Yes, let's get back to this now. Let's get back to this. Okay. Okay, we already went through all of this. Give me 1 second. Okay, remember I talked about the dental tubules, okay? Let me go back. 90 to 70, it was said when I did my research, 70 to 90% of systemic or disease that affects the body originates in the mouth, based on one documentary that I watched, that I was researching. Okay, so what happens? Now here, the root canal, what is it? It's actually a pretty aggressive procedure. When I say aggressive, it's not that you are feeling pain, because of course they're gonna numb your teeth up, but they're gonna do some things to that tooth that I would say would be aggressive. Now, let me just give you a quick background on myself and what I have done. Okay, I was in the Air Force for 13 and a half years. When I started out in the Air Force, I started out as a dental assistant. And so I would assist the dentist. And I worked in an AEGD program, which is called an Advanced General Dentistry program. Okay, now what that did, it put me in a position where I was working with every single specialty in dentistry. So I'm familiar with all the specialties of dentistry because I had to work closely in connection with every single one of them and assist in every single one of them, to the point where I became the leading assistant to make sure that all the assistants had what they needed for whatever procedure they were working in, whether it was braces or orthodontics or gum surgery, periodontal disease, prosthetics for the crown and the bridges, for restorative, whether it's your fillings, for root canals, and even oral surgery. So I'm familiar with every single one of them. Okay. Now, am I trying to prove to you that I'm qualified? No, not really. But I want to let you know that I understand what is going on. If you ask me a question, I will more than likely be able to tell you how to approach it, because I've seen it, I've worked with it, I've had the experience with them. So what is a root canal? It is actually the procedure done when the tooth decay, when cavities, okay, this middle picture, enters the roots or the lively parts of the teeth where the nerves are located, where the nerves is located. This is known as the pulp chamber, okay, diseased pulp chamber. So there's a decay in the enamel. Okay, there's a decay, and you can see those little lines again. Okay, I'm very specific with the pictures that I choose for you to look at, because I need for you to understand this. These lines, like I said, are called the dental tubules or the fluid-filled tubules. It is so vital. These tubules lead to the pulp chamber, where all the nerves and the blood vessels are accumulated, where they are. This is where you feel the sensation for hot and cold on your teeth. If you have gum recession, looking at this picture to the far right, where it says receding gums, those tubules are a lot wider on the dentin than it is on the enamel. And so if you have root exposure or receding gums, you are going to feel that sensation a lot quicker and a lot more intense, because the opening or the diameter of those tubules is a lot wider in the dentin. Okay, now just imagine if you have decay that travel through several of these dentins right into the pulp chamber. Can you say pain? Yes, and that infection now goes down into the root canals. You see on that far picture on the left where it says root, those canals that go all the way down to that bottom line where you see the yellow and the red and the blue, it now has access. That infection now has access. On the picture where it says infection at the tip of the root, now access to your bloodstream. That's another way you can get infection into your bloodstream. You will know this immediately because there will be a lot of pain. Are you guys following me? I hope so. Okay, now watch this. Keep these pictures in your mind, especially those tubules, okay? Especially the picture on the right. I'm going to move on to another slide because I want you to see something. Now, I want you to understand this, that I am not here to steer anyone in any particular direction, simply because the ultimate decision of that person will be solely up to them. And that decision will be between them and God. However, I must make it clear that as Christians, we should be very careful of the information that we use to make our decision that affects our overall health. Okay? Now, according to one source that I looked up, it stated that 70 to 90% of systemic conditions is caused from disease that originate in the mouth. I believe that statement. Okay? Now, I have already discussed how several diseases are directly affected by the poor condition of the oral cavities or of the mouth. For example, we talked about heart disease, and we talked about how what goes on in the mouth, how it can affect stroke, hypertension, arteriosclerosis, and so on. I showed you those pictures, and I talked about it. We talked about respiratory and lung disease, such as COPD, okay, or them being intubated on an ICU floor. As a nurse, I have to make sure that I check my patients' oral hygiene, even though other nurses may not do that because they don't have a background in dentistry. Okay, I do. We talked about how oral disease affects diabetes, which is a major one, because this is where the tag team goes on. You eat the sugar, your blood sugar is on control. Guess what? The bacteria is in the bloodstream. It is having a buffet all day long for that diabetic person. And nobody in the hospital is going to say, hey, you need to go get your mouth clean. Very few. Let me correct that. Very few is going to say you need to go get your teeth clean because that's where your source of the uncontrol is going on. You're not controlling your blood sugar, and the bacteria is having a feast day multiplying in that bloodstream. So it becomes a tag team type of infections. Okay, we talked about erectile dysfunction. We talked about oral cancer. We just talked about preterm labor. However, as I was watching this particular documentary on root canal, it was their belief that because the tooth is connected to various parts of the meridian system, the infection of the root chamber and the root canal in the mouth is more than likely the root cause of other systemic diseases in the body. I beg to differ. They stated that certain types of teeth are connected to specific organs in the body by this meridian system, which, by the way, is evaluated by the electrical current in the body. We do have an electrical current in our bodies. Okay, they said that the amount of electricity, one thing that I looked up, the amount of electricity in the body, I believe they said it can light up a 3-story building. Okay, you need the electrical part. You get that from the heart, okay? Because it is the heart uses electrical impulses to beat. All right. Now, I'm not going to go into the whole anatomy of the heart and such, but I want you guys to know this. Now, take a look at this. Okay, they said that the incisors through this meridian system is connected to the urinary tract. Let me just bring up this picture. These are the incisors where the blue arrow is. It's connected to the urinary tract and the adrenal glands. Okay, they also said that the premolars, the purple arrow here to your right, is connected to or linked to the thyroid, the breast, and the pancreas. And they also said that the molars, that orange, those teeth in the back, are connected to the small intestines. Now, their whole concept and their whole thought.
All right. I'll tell you they can't dip into the money. And even if they do it, who's to judge them? I ask you a question. Who is supposed to judge them? No, you get judged because you're supposed to do what you're supposed to do.
Can you please mute them? Thank you. So, everybody, I want you to just take a moment and pray. The enemy is really not wanting us to learn what God has created us to do for him. Please just take a moment and pray. Okay? And I'm going to pray as well, because it sounds like there was an issue going on. Loving Father in heaven, I thank you so much. You are so faithful and your mercies are renewed every day. Whatever it is that is going on in any of the homes of anyone represented on this platform right now, I pray that your Holy Spirit will enter into that home and grant them peace. In the name of Jesus, I do pray. Amen. Okay. So according to this presentation, they were saying that via the meridian system, the incisors are linked to the urinary tract and the adrenal glands, which means that you may be feeling pain or having issues peeing, or something is wrong with your kidneys, or there's lower abdominal pain that's going on. And the adrenal glands, your hormones are thrown off because your adrenals actually puts out a lot of hormones. You'll see that in a second. Okay. And so they would use this approach to heal the body. Now, they say for the premolar, your thyroid or your breast, and they said that, I think it was 97% of breast cancer, they said, was linked to a root canal on the side that the breast that has the cancer is located. They're going to tell you that. And that may very well be a true correlation based on whatever research that they use, and that's fine. Okay, so but they're using this system to actually do the healing. Okay. I'm going to show you what the adrenal glands, where they're located and all of that stuff, because I love pictures and it actually is very helpful. So just keep in mind where these are. The incisors, your 4 front teeth, top and bottom. The 2 teeth behind them are called your premolars, that's top and bottom. And then it could be 2 or 3 molars, top and bottom in the back. I didn't put the numbers for all of them. There will be too many numbers and I don't want to confuse anyone. It's not necessary for me to do that. Here is what the incisors with the front teeth is linked to: the adrenal gland that sits right above the kidneys. It is responsible for a whole lot of hormones. Okay, especially your epinephrine and your norepinephrine. When you get excited or somebody frightens you and you feel that shock wave of substance going through your body, that's from your adrenal glands. Okay, your kidneys, you can see where it is on the kidneys, but here you have the urinary tract system, which is your kidneys, your ureters, and then your urethra, where you pee, the tube where the pee actually exits the body from the bladder. All right. You also have your premolars that is linked to your thyroid, which is your upper left picture as you're looking at the screen. It is also linked to your pancreas and the spleen, which is the yellow one on your right picture, and the red one, your spleen. Now, your spleen is a major filter for the blood in the body. Okay, it filters the blood, and your pancreas actually produces certain hormones such as insulin, and it communicates with the liver. Okay, and the liver is connected to the gallbladder. So it's really good for us to know the anatomy of our bodies. And it's also said that the premolars is also linked through this meridian system to the breast. All right. They also mentioned that the molars are linked to the small intestines. Well, the small intestines is very, very important because this is where the macrovilli are located, where your body actually absorb and assimilate food for the body to use it. So these are like major organ systems that they have mapped out through this meridian system. So let's now find out what the meridian system actually is. Okay. There. Is that helpful? Somebody just asked me to go back. Now, I don't want to leave anybody behind. I would definitely make sure that you understand. And I'm not rushing through this one.
Excuse me. How about numbers 24 and 25 and 26 on the bottom, the incisors on the bottom of the mouth? What are they linked to?
Those are the incisors, the 4 on the top and the 4 on the bottom. So your front teeth, top and bottom.
Right, because the top seems to be there on this linked to different organs, whereas the bottom is linked to different the organs.
No, the incisors are your top and bottom ones. They're all called incisors. Does that
Thank
make
you.
sense?
No, thank you.
All right. Okay. All right. So, well, what is this system? Okay. Let me pause here and just share the scripture, because I told you from the beginning that I'm going to be using the Bible, the spirit of prophecy, and good science. Okay. Here the Bible says, Ephesians 5 verse 11 says, and have no fellowship with the unfruitful works of darkness, but rather reprove or expose them. Please don't send me any emails accusing me of accusing anyone. I'm just simply giving you definitions and showing you the anatomy of how our bodies were created to function. The meridian system is a system that is directly linked to spiritualism. Okay, and as Christians, we want to avoid anything like this at all costs. Okay, now, what is it? The meridian system, this is a definition from the NIH. Please mute. Okay, so the meridian system shows constellation of acupoints that have common therapeutic effects in acupuncture for the specific system or symptoms of the body part, That's from the NIH. Okay. It is linked with Chinese medicine, and
You muted.
Sister Camille, we can't hear you. No, she's not muted. Sister Camille, your audio is not present. If you can hear me, Sister Camille, we cannot hear you.
I think her internet is down, my sister. She's been having internet issues, so we can pray for her internet to return. You can probably pause the recording.
May I testify?
we looked at this slide before where says that and have Ephesians 5 verse 11 says, and have no fellowship with the unfruitful works of darkness, but rather reprove or expose them. And we looked at the definition of what the meridian system is. It's astrology. Okay, it's acupuncture, and it is actually Chinese medicine that alleged meridians are paths through which the life energy known as chi is flows. Okay, flows through. Therefore, we need to be very careful of what we use to enable and promote health in our bodies, and how we make decisions to be healthy. So if you then, this is where I was, if you then is a medical missionary, a gospel medical missionary, working with someone who is sick, and because the time that is taking to bring them to health is taking a long time for them, okay? And they're becoming impatient, not understanding that disease doesn't just happen overnight. It takes time to reverse the disease. And because it's not happening as quick as a pill would, or some kind of injection, or some kind of alternative healing approach, which does not include drugs necessarily, if they see someone else who is being healed by these alternative approach, they may choose to leave and go with that one, go with that healing process. Now, would this be okay with God for us to go to Baal for help, for health? No. And so that Christian who is following God would choose, or should choose, I would believe, to forfeit that alternative approach and accept what God's will is. whether he chooses to heal that individual miraculously or show them, like Sister Angela was talking about, a way to maintain health the right way, the way that he has ordained. There are many methods and approach to the healing arts, but only one way God approves. Okay, this is pretty much what the meridian system looks like. Okay, and when you look at it, you can see that different colors is associated with different pathways to the body, and they actually link this with different types of tooth structures in the mouth, actually. Okay, this is not something that we should be participating in. Okay, so let's just take a look at what is the progression. Okay, what the progression of a root canal is. An infection of the root is one that starts from the cavity and it spreads to the canal, okay, to the pulp chamber where the pulp is. Okay, so the disease or the decay moves into the center of the tooth. Now, when you look at this picture where it says root canal, it says decay or infected tooth. It starts in the enamel and it works its way through the dentin and now it's in the pulp chamber. Okay, and then it goes right down into the root canals. What the doctor would do, they will drill out more enamel to the point where they have solid and sound enamel and dentin. So all of this black is going to be drilled out. And then they're going to go in with files that goes down the length of the canal, okay, and totally remove all of the blood vessels, the nerves, all of them out of the roots. And then, then they're going to put a filling material called gutta percha, okay, and they're going to fill it in the canals with the pink gutta percha, and then they're going to fill it in with a sealant of some sort. Okay, sealant meaning it could be a filling material. Okay, and then because there is now no nerves or blood vessels to that tooth, they are going to crown it because that tooth is going to become brittle and weak. The livelihood of that tooth comes from the blood vessels. Okay, the livelihood of that tooth, you know it's alive because there's nerves there. Now that tooth has a cut off life support. Okay, I'm hoping that this makes sense because I want you to visualize what's going on. And because that tooth is now compromised, it's going to get brittle and weak. So they will put a crown on that. Okay, hence the crown, and that's the procedure. However, I would like for us to make sure that we understand that a root canal, prior to the restorative procedure of the gutta percha and the crown, it is an infection. Okay, it's an infection. And that infection occurs because something was not right. One of the laws of health, which is mainly owing to probably proper cleanliness of the oral cavity, okay, or just putting certain things in your mouth that will cause the decay, something was violated. Something was violated, either from ignorance or willful neglect. Some law, especially the law of cleanliness, was violated. We already went through the 10 laws of health in one of the previous presentations. Okay, and then on top of that, having the restoration of the gutta percha, they are still researching to see if there's toxicity with this. And I have it up here on your screen here from the web that says the meta-analysis of various studies revealed toxic potential of onset in that endodontic sealers, that's your gutta percha, which may result in a localized inflammation and influence the healing of the apical root in that root canal. Now, when we talk about the apical root, let me just go back to this picture because I should have put it here, okay? Where you see infection on this tooth, that is called the apex of the root. So this thing is supposed to be sealed off, but it's now sealed off with gutta percha. That's a dental material that may be toxic. Okay, I'm not going to say it is because research is still being done. Now, my personal opinion, it doesn't really matter because I'm going to tell you that I personally would not get a root canal done. I would rather just forfeit that tooth. And I'll tell you why I do that. Because if you see this particular, and don't make my thoughts influence yours, please. You have to do your research. That is absolutely vital for every single person who can hear me. Do your research and then make a decision prayerfully with God's guidance. However, this picture on the far right that talks about the fluid-filled tubules, let me share something with you. Bacteria is very small. One of my favorite subjects is microbiology. These things are so small and they have my highest respect because they don't care who you are. This space, this dental tubule space, is big enough to accommodate bacteria. Now, when the dentist goes in or the endodontist goes in and drills and files, I'm going to tell you, they have not touched those dental tubules. And that's one of the things that the documentary actually brought out. You cannot get through those tubules. And if there's bacteria there, then guess what? It's still there. So now you have a material that's in your tooth and you have those tubules that potentially has not been cleaned. Now, let me tell you what they do. When they drill and fill, when they drill out the decay, what they would do in the past, okay, they would take a hypochlorite solution, that's bleach and water, and they'll squirt it into the tooth. And the dentist that I've assisted will walk away for at least 15, 20 minutes. He'll just walk away. And I sit there and I watch the patient and make sure that they're okay. And what I'm seeing is it's just like when you spray hydrogen peroxide on an open wound, you see it starts to foam and fizz. That tooth is fizzing the whole time because the amount of bacteria that's still down there. Even though it's drilled and clean, that thing is still fizzing. That tells me that there's still bacteria there. But because they cannot reach into those tubules, however many thousands of them there are, they're going to just use the bleach to clean that out. And then they put that filling in. And then they crown it. So you're walking around with a dead tooth in your head. Okay? Now, once that happens, you cannot stop. If you have some kind of reaction to the actual gutta percha that is in your head, you're not going to stop it because now it has direct access to your bloodstream from the apex of the tooth. Just keep that in mind. Granted, the procedure and the approach may be well intended, and that's great. And people may do fine for a couple of years, and that's fine, but something else may be going on. Now, I'm not going to tell you to go ahead and get your teeth extracted because that's pretty much what the other option is to forfeit that tooth. Most people do not want to have their tooth pulled, and that's understandable, but it is the cost versus the risk. What is it going to cost you? Now, keep in mind that the counsel from Ellen G. White, from the Spirit of Prophecy, is that the treatment that is given to these people should be affordable. It should be accessible to the common people because it's common people that is having these infections, and God already has made provisions for us to be healed. Keep that in mind as you do your research. Lord, show me what to do, and I promise you He will. Okay? But it must be accessible to the common people. Okay? So just understanding what that is, what it looks like when there's an infection. All right, you have a tooth here, which is that picture on the upper right-hand side of your screen. There's a decay. It goes down into the roots. It causes this kind of inflammation. Okay, we talked about what is Ludwig's angina. This is what it pretty much looks like. It comes in and the infection is so invasive that it can actually cut off the airway. This gentleman with the stuff in his nose is telling me that he's intubated. So they have to now open up the airway because this type of infection will work towards cutting off the airway if it is left untreated. They will give you antibiotics because they know there's an infection going on. And they will tell you, look, you need to go get a root canal. But what are you going to do? You're going to take out the infection to put in something that may be potentially toxic to your body. And you won't know until years later or sometime later, or something else is going on. And when you go to the doctor, they can't seem to tell you what is wrong with you. Could the root cause be in the roots? That's a question for you to answer and to research. Okay, so we're either looking at the infection from a violation of the law of health, okay, and then having to now address it. How do you address it? You talk with your doctor, you do your research, and you make that decision. And if you want to keep flushing it like Sister Angela does, and it's been working for her, then praise God, keep going. If you choose to get it extracted, there's another way to remedy that as well. But we want to be careful what we're putting in our bodies and know what we're putting in our bodies. This is why physiology should occupy first place. Take the time to get to know and understand the body that God has created, and know that He has made provisions for the disease, because the disease is to cause separation, whether it's from extraction or us dying. That is a tactic of the enemy. Okay, we also, I'm finished with this part of the root canal, but please make sure you do your research, and so that you can make the right decision. Now, I'm going to address something else for us as to how to restore it. Should you decide to extract your teeth, I want you to know how to actually approach getting that restoration. Because if you cannot afford buy this material, if you can't afford to buy or sell, you're going to have something in place if that is your desire. I remember at the beginning, I think it was either the second presentation, a young lady asked me, is it better to just get all my teeth extracted? My answer is no. Try to keep as much as your natural teeth in your body as long as you can. But if the situation presents that it has to be done, don't be afraid of it, because we're going to be given a new body. Just know how to replace it. And that's what I want to educate everybody on. Okay? All right, so I did want to touch on this again. Remember, the amalgam composition is what? 50% of enamel liquid mercury by weight is in amalgam filling. This is something that we talked on before. Okay, the mercury is a neurotoxin. Okay, so just be very mindful of that. Now, the next thing I'm going to go into is why is dental care such a problem? And these are some of the barriers to dental health. Financial is the number one. It is very expensive. Dentistry, dental care is absolutely expensive. All right. So we have talked about the cavities and how this can, the decay, how it can actually affect our bodies and other diseases. Now, remember that my sole purpose for this presentation is simply to educate rather share information that can enable people to know how to advocate for themselves and others who are suffering with diseases of the mouth, and or help in knowing what types of things to consider when it comes to the overall health and wellness of the body. Okay, the number one barrier to dental health is financial. So while this is for the United States, 172 million Americans under the age of 65 have private dental insurance. Only 45 million of them have any sort of I'm sorry, there's some type of message coming in and it's blocking my screen. Have some side of any of them that actually goes to the dentist. Okay, now this can be true anywhere. But the thing is, if you have the insurance, please make sure you know what your dental health status is. All right. If you don't, there are other facilities, and I've mentioned it before, that there are public health facilities where you can actually go to and get dental treatment or find out what your dental health status is. All right, and it's in every state. Some state actually requires dentists to actually provide pro bono work. And another affordable place, in my honest opinion, is that dental schools or dental hygiene schools, they're always looking for patients or clients. All right. Transportation is another issue, especially in the case of the elderly and children, because they can't drive themselves to the dental clinic. So transportation is a problem for some. And then you have privately owned dental facilities. Even with coverage, people frequently do not get the needed service due to lack of providers accepting public insurance. That can be very challenging for people. So at this point, if there are any problems going on dental-wise, it is very important to sort out a dental school, a dental hygiene school. Try to get to a public health facility that actually provides pro bono work. Okay. And then the other thing is ignorance, lack of education, and fear. People who are afraid. So just be mindful as a medical missionary, work with these people, try to find it for them. If you're the individual with a problem, know what questions to ask to advocate for yourself. Okay. So how do we approach our dental health? First, if you do not know what your oral health status is, and you have access, I would encourage you to get a dental examination. If you don't have access to professional dental health, start out by implementing good oral hygiene until you are able to get a professional examination, either from pro bono dental work. The RAM is another one. If you look in your area, it's called RAM, Remote Area Medical Clinics. They actually go around and actually provide underserved communities, or go to the schools, or go to your public health service and try to see if you can get an examination there to know what to do. You can then also implement the laws of health. Okay, and you can actually put into practice every day that you commit yourself to learn more about how your body functions. Okay, understand how your body functions and get help and call. You have people like myself who are available to answer questions and to help you. Okay, you have resources out there. You remember that when the mouth is unhealthy, it can cause and contribute to a lot of other systemic diseases in the body. And then when you go to the doctor, because they're not dental professionals, they're not going to even think about your oral health. Most of them won't. All right. So what to do when a tooth or several teeth are lost for whatever reason? All right. There are many options when someone loses a tooth. Okay. Now, I mentioned that this was a question that was presented to me earlier in one of the presentations. All right. There are many options, and it depends on where the tooth is lost and knowing what options are there. Now, I know that everyone may not be in a position to have oral prosthetics, but I am doing this so that you can know what the options are. Okay. Remember, ignorance is a barrier to health. And my main encouragement is to keep as many of our natural teeth. But my main encouragement is for us to keep as many of our natural teeth as possible. So if money is an issue, then I must say that it is cheaper to keep your natural teeth. So please take care of what you have. Now, if a person loses their tooth, they can either do nothing. Okay, they can just leave it there. Okay, if you lose a tooth, if a tooth has to be extracted, they can just absolutely leave it there. Now, what can happen is shifting or super eruption. Okay, can happen. Now, when a person loses a tooth, in this case, it's on the lower left-hand side, that first molar is missing, because we usually have 3 molars. You see the one on the top, 1, 2, 3 on the top. There, a molar is missing. What can happen is that you will have shifting of the teeth just to try and fill that space, because the tooth with the arrow that's pointing directly down, that molar on the top, it needs what's called an antagonist. It needs something to bump up against. Okay? And because there's nothing there, your other teeth are going to shift just to accommodate that tooth. Okay, so just picture if something is affecting someone, the angels of the Lord is going to come in and camp round about to make sure that one tooth is, that one person is safe and is comfortable. okay? Because that tooth with the arrow pointing straight down is going to start to supra erupt, meaning it's going to keep coming up out of their head until it bumps onto something. And the bite is going to be so altered that you're going to actually feel it when you bite down. Okay, the teeth in front of it is going to start shifting back. The teeth in the back is going to start shifting forward, just so that that one tooth can have an anchor to rest upon. Okay, so, okay. So that is something that you want to look at when you are missing a tooth. Okay. Now, because of the shifting now and the super eruption, because when you have super eruption, please look under the gums. You see the roots there? There is no enamel covering the roots. The enamel is what actually prevents you from getting that sensitivity. Now, when you have exposed root structure, the sensitivity of that teeth is going to be heightened a lot. And so when there's super eruption, now the roots would be exposed and the sensitivity is going to be very, very keen for that individual. And there's also going to be discomfort with eating because the teeth are shifting. Okay. Some people may have already experienced this. So please just be mindful. Just get a health status on your dental health. Another thing is you can see it here, this super eruption, where the tooth now is trying to find something to hit up against. It's trying to find an antagonist, all right? And so it will actually push itself all the way down to the gums below so that it can bump up against something. But the roots are now exposed. Sensitivity is there. And then you see that on the very last tooth in this, on this picture, there's a dark area right up along the gum line. That is called a furcation. Now that is going to be very hard for you to clean because your toothbrush bristles is not going to go in there. And this tooth may not have anything wrong with the pulp or the root chamber or the root canals. It's a perfectly healthy tooth, but you cannot clean in that furcation. And so now you run the risk of having bacteria sitting there and a cavity developing from the inside of the tooth underneath. That's like having termites eating out your floor, the bottom of your floor. Okay? So keep that in mind. The other thing is when a person loses a tooth or they have to get a crown, you can get a crown if you have decay and they take that decay off. It's not in the center of the teeth or in the canals. You can get a crown there. Okay, that would be a crown where they just shave off the tooth where it's solid tooth structure and they'll put a crown there. That's perfectly fine. You just have to keep around that area clean. You can also have what's called a bridge. All right, and let me bring up, yeah, you can have a bridge where they now actually put a tooth in the center, the middle tooth here, and then they'll anchor it on the front and the back teeth. But keep in mind that that missing tooth is going to cost you these two teeth, the one in front of it and the one behind it, because they're going to have to shave down natural, healthy tooth structure to anchor that bridge. Okay, that's an option for you. I'm not telling you what to do, but you have an idea as to what are the options. Okay, this is somebody who may have had a decay in the enamel. To prevent that from going into the center where a root canal now becomes the only option or an extraction, this is where now you actually can the crown actually is where you would actually have an option. I don't want to lose that crown. I want to be able to keep it. I don't want to be able to lose that tooth. I'm going to crown it, but you must keep that area clean. And there are safer dental materials that they can use so that it's not toxic to your mouth, okay? That's something to look at. But if you have to lose a tooth and you don't want to have a missing tooth to cause shifting of the teeth, you can put a bridge. And this is why those options are there, because of what can happen ultimately in the process of shifting and super eruption. This is another bridge, mainly of the front teeth. Nobody wants to have a missing front tooth. This is a crown and bridge. So the crowns are your, what we call abutments or the anchoring, and then the bridge would be the actual tooth that's going to replace the missing tooth. Okay. Now, if you don't want to lose any kind of natural tooth structure, healthy tooth structure, then you can opt for what's called a partial denture. So you can save, if you look at this picture, the one closest to you, they would do a small type of drilling, and they will anchor. If you look at the bridge on the top, the one closest to you in the picture, you will see these anchoring on the tooth. It's on the partial denture itself. You can see it on the one on the left. You can see that little silver area there. You can see it on the one on the right. You can see those two little anchoring. And what they do on the tooth itself, they actually just shave a locking mechanism on the natural tooth. You do not lose a lot of natural tooth structure, and they just snap it into that one, and you're perfectly fine. There's not a lot of metal. These are the gum tissue area is just acrylic, and that is pretty much safe for the body, and you just snap it in and it will not come out. It should not come out as you're eating. So you have your natural teeth there and nobody will know that you have a partial denture in your mouth. In the case of people who lose all their teeth and they're edentulous, they can get a full denture, top and bottom. And most prosthetic or dental labs will actually try to make it look as naturally as possible. So if you're a dark-skinned person with bright pink gums like this, they probably won't do that. Okay, they'll probably put it with the pigmentation, but then you'd have to constantly make sure that you take this out because the gums themselves would need a rest. It's like wearing a shoe all day long. And most people don't want to take their denture out, but it's absolutely vital that you do to allow your gums to have air and to rest from having a denture in all day long. Okay, it's not healthy to do that, and it must be taken out and be cleaned properly. Now, the most expensive type of approach for restoration for missing teeth, okay, is the implant. This is extremely expensive. Okay, and this is probably what the dentist will present as a treatment plan for you first. There are some pros and cons to the dental implant, and I'm just here to educate, okay? I'm only here to educate. The pros is that it looks and acts like the natural tooth or teeth. You do not have to take it out, in and out of your mouth, and you can actually clean them like your regular teeth. It's very important that you actually keep this area very clean, okay? The cons is that it is very expensive. I mean, you're almost like putting a down payment on a car or a house for some of these things. If the alveolar bone, if the bone itself, let me bring up a picture so you can see. I want you to understand, if the bone needs to be built up, because when a person loses a tooth, the alveolar bone is completely gone. And so they get down to what's called the basal bone. Hang on one second, everybody. All right, Sister Veronica, just give me a second. Let me finish this one and then I'll get to your question, okay? So if the alveolar bone is gone, okay, which it usually is, then they're going to have to build that bone up. It is up to you. It is very important that you find out what that bone structure is. Having worked in this aspect of dentistry as well, you need to know where that bone source is coming from, okay? In addition to that, so make sure you ask, where is that bone coming from? Is it from an animal? Is it from another person? You just make sure you ask that question and make your decision from there. Once the implant is placed, it must be given, time must be given for the body to react to this foreign object. Is the body going to accept it? What I have noticed recently is that when a person loses a tooth, the offer or the dental treatment plan that is offered is having an implant. And they put that implant immediately in. That is not safe. The dentist will tell you that it is, and that's perfectly fine. And they may show you reason why. You want to give your body a chance to heal from the trauma of having an extracted tooth. You want to give it a chance to heal. And one of the reasons why they do that is to preserve that alveolar bone. All right, but you need to give your body a chance to heal from that extraction. Okay, and it takes quite some time to allow the bone to heal so that you can actually go and drill this implant into the bone. all right, into the basal bone, and then anchor it in. The other thing is, if the body rejects that implant, okay, if the body rejects the implant, it is going to have to be removed. And I've seen that before. And I'm going to tell you, it is a work to get that implant out of there. All right. So you want to be really, really careful to know what your options are and choose the safest and less invasive way. That is what I will personally do. Now, I'm not here to influence you with my personal options and opinions, but you want to make sure, is it worth the cost? Okay, can you afford it? Therefore, it is vital that the discussion to accept the treatment plan is clear before anything is done. Okay, it is very, very important that you understand what is going on. Okay, now, okay, are there any questions? Let me pause it because now I'm finishing up the presentation. And I want to make sure that I answer any questions at this point. Okay, so we have, can you please review the crown only slide? Okay, Sister Veronica, help me to understand what your question is, please. Natasha, if you can allow her to be able to speak, that would be great. Okay.
Go ahead and unmute Sister Veronica.
Mm-hmm. Mm-hmm. Can you hear me?
I can hear you. Go ahead. Just speak a little bit louder.
Okay, I'm going to share a story. Wanted to know, you had meant if you could review, you said you were describing the scenarios where a time this crime would be acceptable.
I'm sorry, my sister, you sound very muffled and I cannot understand what you're saying.
Could you type it into the chat, Sister Veronica? It's very difficult to hear you.
I'm going to go off Bluetooth for a second.
While she's getting that situated, could we take another question, please?
Okay, you should be able to hear me normal now. I took off my Bluetooth and I'm in another room.
Yes.
Okay, you're clearer now. Go ahead.
Yeah. When you were describing this slide, you were saying scenarios upon which a crown would be okay to get if you had to get. You described the scenario. Can you repeat that, please?
Okay, so what I said was, if there's decay and you want to preserve the natural structure of your tooth, especially the roots down into the bone, because once you get into the bone, you are getting closer to the blood vessels. Understanding that the blood vessels is a direct link to the rest of your body, that is when you can consider putting a crown so that that decay does not get into the roots. So they will remove all the decay, and depending on how big the decay is, they will put a crown in on that tooth. Okay. Now, some people have had that happen and then end up getting a cavity under the crown. And then they say, now you need a root canal. Mm-hmm. Okay. So you really have to understand how this stuff progresses and determine what's my best care. Now, if I could get a crown personally, I would get the crown and just really make sure that I stay on top of cleaning keeping that tooth clean and making sure that I know that it is okay, because I don't want a root canal and I don't particularly want to lose any of my natural tooth structure, especially the ones that with the part that it has to do with where the bone is. Okay, so that is one, but know that they're going to remove a lot of tooth structure to put that crown there. Because either way, you are going to lose tooth structure either from decay and the infection or by them restoring it by putting a crown on there.
So my question is, and I think there's a part that I'm missing, and that is when you go to the dentist and there's something wrong with your teeth, typically they say, okay, you have a cavity, I'm going to fill the cavity. At what point is the option that you're educating us on that we can say, No, I'd like a crown. I'd like you to shave my tooth down and give me a crown. When does that happen? Is it well beyond this cavity stage? Help me understand when someone would say, this is the option I'd like.
Okay, so I think we talked about it earlier at the beginning of when a cavity starts. It doesn't just go straight to the center of the root. It actually takes time for that cavity to basically destroy the enamel, then destroy the dentin, and then go right into the pulp chamber, okay, or the root canal chamber. All right. So at that point, because we are understanding what our dental status is with regular checkups, okay, they can say, well, you have what's called an incipient cavity. That is reversible, that you can remineralize with natural remedies. And that's, I'm getting ready to go into that in a second, in this last section. Okay. At that point, you can just reverse the whole thing and don't have to worry about any kind of cavity and maintain your oral hygiene. Okay. So that can be remineralized. Just look it up, remineralization. They're going to tell you to use fluoride, but you can use other things. And there's fluoride naturally in certain substances, like the birch bark tree where you get chaga from. And then there's another one that grapes also is high in fluoride, but they alter the grapes by making it seedless. So it's GMO. So you have to really make sure you know what you're doing and what you're going after. Okay, so just look up natural resources for fluoride, because the fluoride that they're using has a whole history behind it that is horrific.
So I
I'm
think
just gonna tell you that.
I think what the takeaway for me is when a dentist tells us that we have a cavity, we have to ask what type of cavity, because an incipient, is that correct? You're saying
That's correct. That's correct.
Incipient cavity is the one that this scenario is best for. Is that
What
correct?
scenario? What scenario of a crown?
The one we're looking at on the slide. Yes.
No, no. The crown is when there's gross decay.
Oh, gross
The
decay.
incipient is like a little bitty scratch.
Oh, yes. Understood.
Okay.
Understood. You're saying that maybe incipient decay is one where we can actually remineralize it ourselves,
Yes.
Lord willing, and not actually have a filling per se.
Right.
Understood.
Naturally.
Understood.
So when it comes to when it comes to a point of a crown, they're going to tell you have gross decay in that tooth. Now, what happened is that decay can actually kill the nerves in the tooth and you will not feel it. You have initial pain at first because your body's going to tell you, hey, you have a decay. And if people ignore that, or they're not able to get to a dental clinic or get that assessment when they have that toothache, and they ignore it and they don't try to get that help, that decay is going to keep going. It's not going to stop just because you're not thinking about it, or not trying to get the help towards it, or can't get the help towards taking care of it. And so when it becomes an emergency, this is why in a dental clinic, a dental emergency is not gross decay. I just want you guys to understand that this is how the dentists are going to approach it. This is not an emergency. This is something that you have had going on in your mouth, and they're not going to treat it as an emergency. They're going to say, well, that's negligence. And so I cannot. And so some of them were like, no, I'm not going to try. I'm going to try and get you in as soon as I can, but you have to go to the emergency room. You have to go get some antibiotics. You have to go get some painkillers. Okay. So you have to understand the approach.
Yes. So I guess my question is, and I'm trying to remember, I remember having a tooth issue, and I don't remember having a crown, but I think it was my real tooth was cracked.
Okay.
And they said, you're going to need a root canal. And I said, well, no, can we try to save it? And so we waited a while, years. I don't remember what happened. Actually, you know what wound up happening? The tooth wound up breaking. And then I wound up, at that time, my understanding was, do not remove your teeth. Don't remove anything from your body. If God put it there, just leave it. So the tooth was eventually removed this year. The tooth was removed this year. And I'm pretty sure that's the tooth that was cracked some years ago. And they said, oh, we need to do a root canal. And I said, but I'm not having any pain. I just wanted to know, what is this my tongue is feeling?
Mhm.
And they said, it's a cracked tooth. I don't remember if it was on two sides of the tooth or whatever. It's one of the ones all the way in the back. And the dentist I had wound up leaving it alone. And so anyway, that's what happened with that. I just I wasn't sure when a root canal was was the better option to get if you're at that point. Because typically, if I'm trying to follow and retain what you're saying.
Mhm.
Typically, when I'll say disease or the tooth decay, the decay is so bad, this is really when they would say pull it. Because I've never had an option where they say, I've never heard of an option where they say, oh, I'm just going to give you a crown, not a root canal. I'm just going to give you a crown. I'm not talking about people with the chipped tooth. I have seen people with chipped tooths and they get like a crown over it to make it look normal. And what's it?
Can I interrupt for a moment? I think that what you're trying to get at, Sister Veronica, or
Thank you.
ask
No, if you
for,
follow, please go ahead.
Camille, is a root canal is given as an option when what the possibility is for extraction. Things are so bad that an extraction is needed, but in an attempt to quote unquote save the tooth structure, they say, hey, we can do a root canal. Is that correct?
Okay. The point I'm trying to, let me just make this very clear.
Okay.
Okay. You have several stages of tooth decay.
Mhm.
This is just really another access for infection to get into the bloodstream. Okay, this is just another access besides the gums that I showed you the picture of earlier. This is another access to get infection into the bloodstream. Look at these two pictures. The first one with the atom on the bottom, you have the blood vessels there. Here's an infection that starts from the enamel itself at the top where it said decay. This decay has become rampant, and it's what we call gross decay when it goes down into the nerves and the blood vessels, not has access to your whole entire body. Hence the systemic conditions that may manifest themselves or be harder to treat because you have this one tooth that's causing a problem that most people probably would not look at. So coming from a dental perspective, you want to understand what are the different stages of tooth decay. It starts out as an incipient first. At that point, you can actually reverse it because of the remineralization. Once it gets into the pulp chamber or even anywhere close to that pulp chamber, okay, that is when they're going to say you need a root canal because guess what? The decay has been far gone. And this is something that was not addressed that was obviously there before.
And
The
once
decay
it
was there.
gets to the pulp chamber, it can hit your body's systemic bloodstream. Is that correct?
That
Yes.
it's going to hit the
Mhm.
bloodstream.
Okay. I see
Okay.
a few other hands up. I want to be sure we get to them. Let's first go with Angela, then go with Sandra, and then have Sister Danetta share what she shared previously, but you were not
Hold
on.
on, there are questions in the chat as well. So
Okay.
Sister Angela, please go. And I'm gonna ask if you can make it brief. The question needs to be
Yeah,
direct for
it's
me.
not a question. Well, I have a question for you. If you have a comprehensive listing of holistic dentists, or if not, where can I find? Because somehow I've been looking for it and I can't find that.
Please
And I'll make
go ahead.
and I'll make a statement too. I think folks need to remember doctors are not God. They have to advocate for themselves. I was in a dentist office in New York City, and he came in and he did wash his hands, and then he put on the glove. The phone rang and he picked up the phone. So when he came to me, I said, but aren't you going to wash your hands, Dr. John? He said, I just washed. I said, yeah, but you put on the glove and you pick up the phone. And we went back and forth, and he wouldn't wash his hands. I was working at Top Fashion magazine, had another bag with a lot of content that I really need. I said, oh, can I go to the bathroom? I went, I went into the bathroom, I left, I never went back. They never called me for my back because to me, he was just downright nasty for a physician. He's gonna
Okay,
handle the phone and then so I had a problem with that. Advocate for yourself.
pause. I know that there are experiences, and you definitely want to make sure that you are definitely advocating for yourself, but every situation is not going to be the same. This is why advocating for yourself is vital. But one thing I do not want to encourage is the stories where it actually puts other thoughts in other people's minds to be afraid of the dentist. We're still dealing with the mind. Okay, so please, I'm going to ask if we can be very mindful that horror stories or unfavorable stories is not helpful. Let's just stay on the positive side. You're absolutely right, Sister Angela. Doctors are not God. Okay, they are not God. And so you want to make sure that when you go towards any of these things, you use the resources that you have. You research, you ask questions, and you tap into the resources that you have. It's Google, it's books, it's people like Camille and other hygienists. Okay, because we function as hygienists, we function off a preventive dentistry mindset. Okay, so let's just try to encourage, all right? There's one question, there's a hand, but I want to do it back and forth. Can bone restore naturally? It can, but it's going to take a long time. You have to know how long it takes for the bone to regenerate itself. Okay? All right. Sister Marcia, let's see who has their hand up. Okay, Sister Sandra, you were up next. Go ahead. What is your question or your comment, please?
Yes, you said you work for the Air Force. Thank you for your service. I was watching, and I actually thank you for this presentation because I was just recently was told I needed to do a root canal. So, and I was very apprehensive. So I information so it can make my decision more definite. But I was watching something on YouTube, and the guy's, I guess he was in the Navy. He worked for the Navy Dental, and he stated that sometimes things that go on with the teeth have to do with respiratory issues. And I wanted to ask about that because I noticed after I had COVID, with the wearing the mask all the time and things like that, because I was the first, so we always had to wear masks. And so I wanted to know, have you seen any research where this is the case? Because I have been having a lot of lung issues, and I noticed since I had the lung issues, I've been having more problems with my teeth, which I very rarely had any problems with my teeth.
Okay, so some of the respiratory issues that I know that can be an issue for you would be sinus issues. Because if you look at the anatomy of let me see if I can pull it up. If you look at the anatomy of where the sinuses are on this picture here, I don't know if you can see my arrow, but if you go right there, smack, look in the middle of, can you see my arrow moving?
No, but I know where the sinuses are. Yeah, I see the holes. Yeah. Right.
Okay.
But I do see one little arrow at the bottom.
Okay, so no, look at the very middle of the picture, right dead smack in the middle. Okay, you see a line and some dark areas. To the left of that line, right in the middle of the picture, you see like a half a moon on both sides. It's like a circular form. Those will be the eyes. Now, if you come straight down that middle line, you see a really, really white area. If you look to the left and to the right, you see another, it's not a circle, but it's another outline of a dark area. Okay, like if you're looking at the lungs on both sides, okay? Those are the sinuses. But if you look at where the sinuses are in relation to the roots of those teeth, if there is any
It's
kind
right
of
there.
discomfort, you would definitely feel some kind of pain in your teeth. Okay,
Now,
because
mhm.
so when you say respiratory, your respiratory issues is not going to cause you to have decay in your teeth. All right.
But this is what I wanted to ask you, because I
Mhm.
never had sinus issues till
The COVID.
right. So I
Right.
never I just really actually this year, and I had COVID 3 years ago. So I mean I just started having sinus issues. Um so that's why I wanted to know, because I mean like, but the tooth thing started probably 2 years ago. Maybe like a year after I had COVID.
Okay.
Um,
So this is what I'm gonna have to do, because um whenever there is an issue with the tooth, it's not connecting for me. So I'd have to ask you more questions. It doesn't connect to me that the respiratory is causing issues with your teeth as far as as far as needing root canal. Okay.
well, the root can, I mean, the root can, I just mean like, I noticed since I wore the mask, well, I ended up getting a cavity, which I didn't have. And well, my tooth chipped. So it was just like Sister Veronica was saying, it was like a cavity, then chipped, and then, but that was after I started wearing the mask. I didn't have a cavity in that tooth before.
Okay. It may not have been found before, but a cavity takes quite some time to develop. And I would definitely need to talk with you one-on-one to do a little
Okay.
bit more assessment, because um, wearing the mask, the air doesn't, what causes cavities is not the air. Okay. When you're wearing a mask, you're breathing your own carbon dioxide, and that can make the blood acidic, but that's not going to cause you to have cavities.
Okay.
You understand what I mean?
Yep.
So, Sister Natasha can a number there so that you guys can have it. But I want to make sure that you understand what causes the cavities and then how we can address it. There's a lot more going on that I would have to ask you some other questions. Does that make sense?
Yes.
Okay. And I'm more than willing for anybody who has called me before, I'm more than willing to sit down and just explain it to you, because this is something that's just important. Okay? Okay. Sister, let me see. Let me see let me just check a question in the, if there's any question in the chat, in the text.
One question in the chat is, what can be used to restore the bones?
Okay, hang on. What they use is cadaver bones. What they use is cadaver bones. Now, there are other things that can be used. If you look up, now, one thing I want to make sure I make very clear, I am not prescribing any herbs. I'm not going to tell you to go use this or go use that, but there are natural plants out there that actually helps with the bones and restore it. And I'm going to encourage you to look it up. And if you don't know, then you can call me personally. I don't want to encourage anyone to think that, hey, what can I use for this? What can I use for that? I am not going to encourage that. Because you see, the thing is, when you're dealing with the body and there's something going on with one part of the body, because the blood supplies every single part of the body, another part is going to be affected. And so we want to make sure that we're addressing the whole entire system. Okay? So there are certain materials, plants, that actually encourages the bone to be restored. I'm just going to tell you that I've used it myself. I've seen it. And I'm just going to tell you that. But if you cannot find it, you make sure you give me a call. Okay. Okay. I saw another question here. No. How do you know if the body is rejecting the implant? There is going to be inflammation, there's going to be pain, there's going to be pus, there's going to be a serious infection that you have to take care of immediately. I've seen that with my own eyes. You will know. And this is why when you put the implant in, usually what was done when I practiced with the periodontist that actually put the implant in, we would give them like weeks and actually like a long time for the body to assimilate, knowing that this foreign object is in the body. So you have to give that immune system a chance to recognize, okay, this is okay, I'm okay with it. So you would know the body's going to react very, very loudly that this is not working and this needs to come out. Okay, Sister Marcia, you have a question?
Yeah, I just wanted to ask this. If someone already have the root canal done, what steps can they take to have them removed? And how can they go about doing that?
Okay, I have seen there's some videos on YouTube where they actually say you can remove the gutta percha. That's up to that dentist, and you usually want to go to a holistic dentist or what they're called biological dentist, because there are ways to remove these things. But if it's a root canal and there's no tooth or crown there, then the best thing to do is actually just to get the roots extracted completely. And then to use the options of what I showed earlier, whether you want to have a bridge, implant, or a bridge or implant is the only, or partial denture for it. That would be your best thing.
Okay, just so when we go to them, just they would know once we say we want the root canal to be removed, they would know how to go about doing that.
Yes, definitely yes.
Okay.
They would definitely they're going to give you the option. They're going to give you the option of an implant first. Then they're going to tell if you want to have a bridge, if you have teeth surrounding that space to accommodate the abutments or the bridge or the anchoring for the bridge, or they're going to tell if you want to have a partial denture. And having seen what I just showed as far as a bridge here on the screen, or there was another bridge, depending on where the tooth is, or you can do a partial denture and keep as much of your natural teeth as possible. Or you can do an implant. They're going to give you those options, but you're going to have to determine which one you think is the safest for you.
Okay.
Or which one you want.
Will there be any after effect to the body system? Will there be any like issue to the body after that is taken out?
There shouldn't be, because you're removing the root cause. One of the possible root cause. Now keep in mind that if the tooth is removed and it's because it has some kind of material in it that your body does not like or reacting negatively to, or if there's some kind of infection and you remove that tooth, you now have to make sure that you clean up your body as far as cleaning up the blood and making sure that that is taken care of. And then you just maintain your health by following the laws of health. You should not have any problems at all. Unless something else is going on in the body that needs to be addressed. But once you detox your body and clean up the blood and maintain keeping that blood clean, because we're constantly exposed to toxins all day long, just keep it clean and follow the laws of health. You should not have any problems because you have done everything to remove the root cause.
Okay. All right. All right. Thank you. Thanks.
Okay, so there was a question in here on okay, upon dental x-ray, can decay in the pulp chamber be seen? Yes, it can. We are actually trained to see that on the x-ray. You can see, and this is when they would say you have gross decay, because now it's not, whenever they say gross decay, it's into the pulp chamber. Okay. Should we remove wisdom teeth that are not giving any issues? No. Leave them there. If you can keep them clean and you don't have any cavities there, and they're perfectly fine and they're functioning fine, no, you don't need to remove anything. Okay. Let's see. Okay, good question. Do all the wisdom teeth break through the gums? Let me show you this picture again. Whoever is that iPad, I don't know who that is, but this picture that I just showed is a classic. Oh goodness, I wish I could find this quicker. You see this picture on the screen where the two black arrows are? That's a wisdom tooth. And it is not going to erupt out the gums. Okay, it's going to push up against those other back teeth. It's going to be very painful, or it can cause a cavity to develop on that back tooth that's already erupted. And then both of them will have to be removed. That is what you would have to remove as far as a wisdom tooth is concerned. Okay, hopefully you can see that. So on that left side, where you have those two black arrows, that is a wisdom tooth that is not growing in a vertical direction, it's going in a horizontal, and it's going to compromise that tooth that is going to hit up against. Okay, so that is something that should be removed to prevent you losing two teeth and really messing up the bone back there until it heals, because it will heal. Okay. Thank you, Sister Veronica. Okay, what kind of metal or plastics are implants using? Wouldn't that be problematic? You would have to look it up. There are several different types of metals that they use. Nickel titanium is one of them. If you're allergic to that kind of stuff, I would not suggest that you do to use that. But then you just want to look at what your options are, and you want to go for the least invasive treatment. Doesn't matter how much it costs. Just go for the least invasive treatment if that is an option that you're faced with. And this is why I showed those different types of restorations. Okay. All right. Are there any other questions? Because I know that can you pause for me for a second, Natasha? Okay. Danette, darling, please help me to understand what you're saying. No, they need to respond the periodontal ligaments, or you can still suffer insidious infection. I don't understand what that means.
I was just responding to another sister about when I do root canals, they remove all the roots. No, they do not.
Okay. So looking at the question before, all right, looking at the question before where it says
the roots on the bottom of the apical, out of the apic to ligament, that has to be removed.
Okay.
They remove all the roots. No, they don't. When I do root canal, they're hanging out there out of the apic, and that's where I got my infection.
Okay, looking at this tooth here, I want us to make sure that we understand this again. You see what the periodontal ligaments are? They are along the whole entire length of the roots. A root canal has to do with the center of the roots where the nerves are, where it comes up into the tooth from the body itself. All right? Periodontal ligaments, and that has to do with the supporting structures that holds and anchors the teeth in the body. If a person has a root canal and they're removing the roots, not the pulp that is in the canals, they would have to extract the whole entire teeth. Okay, and so they would have to pull it from what it's being anchored to. They're going to have to remove it from the periodontal ligaments, because it's the periodontal ligaments that holds and anchors the teeth to the bone via the cementum. Okay, so when you get a root canal, they're not removing any parts of the root, they're just removing the nerves inside the root canal. All right, so when you're talking about they need to respond to the periodontal ligaments, or you will still suffer insidious infection, that's not exactly accurate, because you have to make sure that you remove all the disease, blood vessels, and nerves from that decay. All right. If they leave any little bitty piece of a nerve that is infected from the root canal, you will feel pain. You are going to continue to feel pain because the nerve is still alive, but it's also infected. All right. The periodontal ligaments doesn't touch the nerves at all. I don't know if that makes any sense, but it doesn't touch the nerves at all. So something else may have been going on if they had to deal with the periodontal ligaments themselves.
Yeah, I think what I would say is, like, you know, even if the root canal, you can still have an infection, because I had an infection.
Mm-hmm. You're breaking up, my sis. Can you?
And I had to I got an apicectomy, which was a foolish. Underneath there's something. I'm sorry, and cut that off. I think in the apicectomy must have been something there left over, and that's what it is. And also, in order to, when you pull the tooth, I was told that in order for it to ensure you don't have any infection from the root canal, the tooth must come out and the periodontal ligament must be pulled out, cleaned out completely.
Yes, when they extract the tooth, they have to the periodontal ligaments is going to be detached, and they will have to make sure that that cavitation or extraction site is clean. Okay, but if they do an apiectomy, that meant they went in and cut off the tip of the roots, which is a whole nother surgical procedure. You know, and that is the problem.
Waste of money. Waste of money.
Yes. Yes, it's very expensive. Now, if you don't have any other questions, I don't see any other hands, Natasha, because some of my group members are supposed to be meeting at 12, and they've been so very patient. But if there's no other questions, I see a question from a Cynthia Bonus. Let me hear your beautiful voice.
Did Sister Danetta get to share her testimony?
Let me just answer this one question. Oh, wait, I'm not even finished. Hold on. How to naturally treat a cyst on the tooth. I have to get back to you on that one, because what kind of cyst are you talking about? That is my question. Okay, let me finish this up for everybody. I want to just quickly go over this with everyone, okay? Now, how to prevent all of this? You have to how to prevent all of this. The number one thing is your oral hygiene. I'm pretty much finishing up here. Okay, the main who is this, Dr. Smart? Go ahead and ask your question, please.
No, you can finish what you're saying.
Okay, all right. Just don't forget to ask your question. All right, because I would love to hear it. Okay, you want to brush at least twice per day, but ideally it's best for us to brush after each meal. This is really twice a day, or if you eat 3 times a day, then you should be brushing your teeth. We do not snack we don't encourage snacking between meals, because you're going to overwork your stomach. Another thing is to floss. I'm going to get a little bit more into that in a second. You also want to rinse. The reason for rinsing your mouth out, you don't have to rinse with the antiseptic mouth rinse or anything like that. The whole point is to get the debris that you just brushed and flossed off out of your mouth. You can just use simple water. Okay, if you're going to use an antiseptic mouth rinse and you want it to make sure that it's natural, one thing that you can use is, I found this on Dr. Axe's website or his site, and basically he just used tea tree and peppermint in some water. And you cannot use a lot of it, because I have tried that before, and that peppermint and tea tree can be very overwhelming if you use more than 1 or 2 drops. I can tell you that, you know, and your breath will be minty fresh for hours. I can just tell you because I've tried it before. But you simply need water. Okay. We talked about mouth rinses and the different kind of things you can brush your teeth with. So on the next slide, I'm just going to go a little bit more into that. But based on the patient's skills and needs, you have people who may have had a stroke, or they have some type of rheumatoid arthritis and they can't hold the toothbrush as small as it is because they don't have the dexterity to do that, you can make it you can make that easy for them. Like if you're a caretaker for an elderly person, you can just stick the toothbrush in a tennis ball so they have something to hold on to, you know? Just be creative. You also have things like floss threaders and floss threaders and the interdental brushes that is angled at 90 degrees for people with braces. So you want to keep it in between those brackets clean. You know, if you have braces, you have sonic toothbrushes. That's another thing that is very good to actually clean your teeth. It actually moves a lot faster than you can move when you're mechanically brushing your teeth. But the plaque needs to be mechanically removed, whether you use a toothbrush or a rag for baby or a sonic toothbrush, you need to make sure that you're getting the plaque removed and it must be mechanically removed. All right. The other thing is the amount of time that you do. And then you need to also have very good denture care if you have dentures. Okay, when you are cleaning your dentures, make sure you take it out of your mouth. Your gums need to breathe. They need to be exposed to air or just be relaxed, like taking off your shoes. You wouldn't go to bed with your shoes on, so you want to make sure that you do that. Make sure that you take them off occasionally. Now, I was going to say something about the toothbrushes. Yes, when you're using your sonic toothbrush, I know people have the habit of moving their toothbrush around. When you're using a sonic toothbrush, you do not want to move it around. You want to just hold it on the teeth, direct it towards the gum line, and make sure that you just hold it there and let it do the brushing for you. Because if you do, you're going to miss it. It's possible for you to miss some points. When you're using floss threaders, you don't want to use one little bitty floss threader for every single tooth. Otherwise, you'll be moving the bacteria from one space to the next. So you would have to use a new floss threader for every single space if you want to avoid moving the bacteria from one space to the next. And we already talked about getting a dental exam to know what your oral health status is. And depending on the extent of any kind of oral disease, especially gum disease, they may determine that you need to get your teeth cleaned quite frequently, anywhere from 3 months to 4 months. I'm sorry, every three times a year or 4 times a year, at least 2 or 1. Okay, so just keep that in mind. Now, I don't know if you guys remember from our last meeting or presentation, this environmental work group website was something that I shared with you as far as how to know what type of material you are using in your body. Now, I need to take this off the screen because somehow this did not come up properly. So let me just remove this, all right? And I'm gonna put it on a new slide so you can see it. All right, so here we have a guide for safer personal care products. You will actually put the actual item like toothpaste in here and it will actually tell you what the rating is. If you have this seal, it's actually a pretty safe, non-toxic material that you would be putting in your mouth. Anything that is up to 10 or in 7, 8, or 9, or 10, it is definitely going to be, you will have chemicals in it that is not good for your body. So please be mindful of this. And it's actually called the environmental work group, or it's called, how I learned about it many years ago, it's called cosmetics database. And so you get to learn what is actually in the product. It's for any products you put on there. What is in the product so that you know what you're putting in your body or on your body. So if you look up lotion, shampoo, toothpaste, anything, it's on there. So just please make sure that you are aware of this. The other thing is, let me see, do I have anything? Okay, so the other thing is, what about using natural products like Uncle Harry's Dental Herb Company and etc.? This was one of the questions that came up to me earlier. I think it was like the second presentation. What natural items can you use to keep your teeth healthy? I heard horsetail is a must. All right. Again, I'm not going to prescribe any kind of herbs because if you have any, I do not recommend any type of products or herbs. One thing is that I am a licensed dental hygienist, and it is illegal for me to do that for my per my license, okay, and the governing body of my license. Reason being is that if I tell you that you could go use Uncle Harry's, or you could go use Horsetail or Total or Colgate or anything like that, and you end up having some kind of an allergic reaction, I am liable, because you can say, well, Sister Camille told me this, and this is what she said I can use. This is why I do not recommend any type of material or substance or solutions to anyone. It is for you to do your research, because I do not know what your body is allergic to. And if you have an adverse reaction, I'm going to be held responsible, and rightly so, because of negligence on my part within my scope of care based on my license. So as far as natural products, there's a lot out there. You can try them and see which one works for you, but they are out there. Now, I have used a particular item, and it actually, I was having sensitivity on my teeth, and it actually worked. I mean, within a week, I noticed a marked difference. Some of them, when I do the research as far as remineralizing the teeth, you guys are going to have to understand the whole chemistry part of this. Just like when you have like a child in school and they're making crystals, the enamel is like crystals. And if you have the right environment, the right solution, and the right environment generally for it, you can remineralize your teeth. And some of these products actually do that. I've experienced that myself. I had like 3 like crack lines on one of my front teeth, like right there smack in the front. And a little bit of what's called enamelplasia, meaning that the enamel did not fully develop on my front teeth. I'm giving you my experience. And I'm going to tell you, after using this particular product, that thing went away. So that tells me that the enamel was now fully developed. And I am amazed at it. Now, if you call me, I'll tell you personally what I use. But on this platform, I would not do that. Okay? But there are things out there that you have to understand the concept of what's the enamel. It's like a crystal. It's like you're growing a crystal, but you must have the right environment for it. Research that, okay? However, the same material that I was using, because of how much I was using, it actually caused an adverse effect on the roof of my mouth. Okay, so I had to pull back. So you have to understand how much to actually use. And I didn't know that. So I had to pull back on using it. It still works, but I don't use it as much. But I had to learn that. So if I tell you to use something, I'm going to be responsible for you having an adverse reaction, because it was very uncomfortable for me. And believe it or not, my husband was using the same thing, and we both experienced the same effect of having this like sore area on the roof of our mouths. And we just pulled back and it was gone, like the amount. So you have to be careful how much you're using. Always start with just a little bit. Okay. So horsetail, I know, is high in silica, and I understand how silica works, because it actually works with calcium, I believe. And so you really, okay, if horsetail is a must, then so be it, but I cannot tell you that that's the main thing to use. Okay. So let's just talk about proper oral hygiene. When you are brushing your teeth, you want to have your toothbrush directed at a 45 degree towards the gum line. You want to make sure you get that plaque off the teeth, and knowing that the gums does not attach all the way up to the tooth. Okay, you have that little sulcus or that little pocket that's about 3 millimeters, 2 to 3 millimeters in depth. You want to get your toothbrush bristles up under that space to brush it off. If you're using a sonic toothbrush, just hold it there and let it do the work for you. Okay, this is what it pretty much looks like. That where the bristles are up under the gums is where what's called that sulcus or that pocket space. All right, and more specifically, you want to brush all surfaces of your teeth. the front, the back, the inside or the tongue side, or what we call the lingual surfaces, And so you want to make sure you're brushing all of your teeth, but that's just brushing your teeth. You also want to make sure that you brush your cheeks and your tongue and the roof of your mouth, because bacteria is all over the mouth. So you want to make sure that when you're cleaning or brushing your teeth, you're keeping the whole entire mouth clean. Okay? Now, when it comes to flossing, it is very important. Cavity zone. Remove plaque and food from your teeth. Help fight cavities. Okay? Here, if you look at this picture, this is the cavity zone right in between the teeth. And I can see tartar, Sister Veronica, on these two, in between these two teeth. Or it could be food debris. You have this area where you go in and you just come right up to the point where the gum is, and then people would stop. But you do not want to stop there. Remember the sulcus. The area of the gums that rests up against the tooth is vital, okay? So this is where you need to be. You see where the floss is with the blue line? It stops there. But you need to go way up under the gums. That is where the gums do not attach to the teeth. Remember this picture? So what you're doing when you're flossing, you're actually flossing this area to keep the plaque off the tooth so it doesn't form into tartar and cause irritation to the gums. So it is very important to floss here, right up under the gums. But you want to be careful not to use the floss to cut your gums and cause what is called flossing clefts, because now the aggressive flossing can create space for bacteria, even in the gums itself, to lodge itself. So please just be mindful of this. This sulcus or this pocket area is where you really want to floss. That's the whole purpose of flossing, in between your teeth. Okay? Now here's the natural, you can print screen this if you want to, but I took this from Dr. Axe. And this was the mouth rinse, the natural mouth rinse. It's antimicrobial, antifungal, because tea tree is antifungal and microbial, bacterial. Okay, the peppermint is for the freshness, the spearmint as well is also good, and the lemon essential oil. Please, you don't have to necessarily put any calcium carbonate powder. You don't necessarily have to do any of those things. Okay, just use it. Just use the first up to the water. That's all you need to do. I see an agenda coming up on my screen. Now, do you have any questions? Because I am done. Sister Veronica, we talked about oil pulling before. It's in, I think, presentation number 2.
Wow, thank you so much for everything that you shared, Sister Camille. This takes us to the 3-hour mark. We would be just remiss if we didn't just praise the Lord for you and the work that you're doing and coming to share with us in this way. So much has been put in the chat, so there are resources there. Parts 1, 2, and 3 are also there. May we close with a word of prayer.
Wait, Dr. Smart had a question. What was the question?
Most likely you answered my question with your presentation. I had my 101-year-old, she cannot spit when we wash her teeth, brush her teeth. Most likely we prepared something natural for her. So I was wanting that is like a remedy. So this is a powder, and then whatever she swallows, if she swallows it, it's okay, because it's not going to hurt her. Only her own saliva whatever was in the teeth will hurt her, because she cannot, we ask her to spit, she cannot spit anymore.
How is it that she's not spitting?
We ask her to spit, she's not. We tell her to spit, she just follow it. So we prepare something like a medicine. So
okay, I'm gonna bring up this screen because there's something I want you to see.
And the other question was, is the implant with porcelain okay?
Is the what?
Implant with porcelain implant.
Okay, so the implant and the crown are two separate things. So you have two different sections of dentistry that is working when you decide to get an implant. The implant is just what was actually put inside the bones. Okay,
Yeah, because I had a number 4 that was broken by itself, just broken, and then I had to replace it. Not replacing, it's still not being replaced. So I wanted to, the doctor is looking to put a bridge or something like that. Then the way he has to cut some of my teeth, a lot of stuff. So I've said that an implant would be easier to just give an implant, but I don't want to put any metal.
Okay, so here you have the implant. Can you see my screen?
Yes, I did.
Okay, so the implant is actually the silver screw. That is the implant. That's the implant itself. And then you have prosthetics from a different specialty in dentistry, the prosthetics. They're the one that makes your crown, your bridges, your dentures, your all those things. What they would do, working in concert with the periodontist, they will actually make the crown, which is that tooth structure above the screw. That will be porcelain or whatever. It's usually porcelain, that material that they use, and then they'll screw that on. Okay, they will actually screw it on, like you can see the pictures here, right, to anchor them onto the implant. So whatever material that they're using to give you the final restoration is separate from the implant itself. So the implant is never going to be porcelain. That's the crown part of the implant. So you have the implant itself, and then you have the crown part or the prosthetic part. Did that answer your question?
Yeah, because from the I saw from the picture you teaching, you're telling, I see there, this is a metallic thing that they put, and then they put the tooth that could be porcelain or whatsoever. But I assisted to online series of conference on dentistry, and they were saying that they do not recommend. So many people had cancer, had paralysis, a lot of things from those kind of implants. That different type of, I don't remember which one, but I will read because I get the thing, I didn't read it yet. So they said that instead of the metal here, you put porcelain in it.
Porcelain in what? In the crown or the actual implant itself?
In the implant itself.
Okay, I have not seen that. I can look it up and get back to you.
Okay.
But the thing is, yes, the metal, that nickel titanium that they use, it has an affinity to the bone. And once that screw goes into the bone would either love it and wrap itself up completely into it to the point where it's going to be even hard to screw it out if you have to take it out. And I've seen that. So the thing is, you have to know what you're putting in your body. Now, keep in mind that if there is a concern and you don't want to have the implant, you don't have to touch that bone at all. It's not going to go anywhere. Once the alveolar bone or the bone that surrounds the tooth itself, because the tooth is gone, you're going to have what's called the basal bone. And that is what gives that flat appearance to the gums in that edentulous space. And so you can actually put a bridge there. Now, for people who don't want, if people don't want or a partial denture there. Now, if people don't want to do that and they want to go the implant route, they can, but know that your body must accept it and know what material that they're using and see if your body will be okay with that.
Because they said that it is not a lot of dentists do that procedure, because instead of putting the metal, they put the porcelain.
Interesting. Okay. Okay,
So
I'll have to look that one up myself.
More research. I will go to read it, and then I will consult with you.
Zirconia. I would have to look that up, Sister Donette. Zirconia. Okay. Now I wanted to show you another screen. I wish I can. Okay, sorry, let me end this and I'm gonna go back to my other slide as far as the little one that you spoke about, because it's very important. The children are very, very key to me in this case. Now, this is the skull of a 5-year-old, but you said the child is 1. Okay. That child would more than likely already have up to their 2nd molar in their mouth. Okay, their molars in their mouth. The main thing for that child, if they don't want to spit it out, that's fine for the most part. But the main thing is to get, as soon as that child is finished eating, teach that child to just go ahead and brush their teeth. And you show them to spit it out. Okay? Let him or her brush their teeth, and you go back and brush and get something to get that plaque or the food debris, because it's the food that the bacteria
This is not a
feeding on.
child. This is an adult. 101. 101-year-old.
101 years. Okay. That's awesome. That is awesome. So if they don't want to spit it out, you can probably.
She has most of her teeth. Some of them are broken. I did not even know that when I went to a dentist to having a cleaning, and then I saw she has some teeth that are broken, 1 or 2 on the lower side, and she has to go to the hospital for them to extract them. So.
Okay, another thing that you can consider, depending on how invested you are in this individual, you can actually get a portable suction where when you're cleaning her mouth and you have like the syringe to like squirt the water in, and then you have like a little portable suction that can actually suction it out. That's what I would do.
That's an idea.
So you can get that stuff
How
out
do
of
you get that at home?
Just look it up, portable suction, dental suctions. That's easy.
Oh, okay, portable dental section. Okay.
Yeah, and then you can just squirt. You get the syringe to squirt the water in their mouth when you brush your teeth with an electronic toothbrush. Does that help?
Idea. Yes.
Okay, great. So there's the things are out there. I promise you, they're out there. And if not, I will help you find them. Okay.
Thank you so much.
You are welcome. Okay. Are there any questions?
I had wanted to know for the implants, won't that metal leach? And the reason why we don't want, to be in contact with heavy metals, or with the plastic, I was looking at the picture and it looked like it was plastic and then metal, or I could be seeing wrong. I mean, I've never seen it that close before. I was just concerned about the plastic if it's plastic at all, how they say plastic is a hormone disruptor.
And then the blue one?
Yeah, it did look like plastic, right?
Yes, it does.
Okay. So it's not plastic. I can tell you that much.
Okay, great.
And the thing is, I'm not trying to put out there that these things are 100% foolproof or safe. I am just telling what the options are. Where's my thing? I don't see my, okay. So this is porcelain. Porcelain is not plastic. Okay, it's like very, very hard, and that is not going to.
Like you see the blue thing? The blue thing.
The blue thing. It looks like a plastic, the one you put on the wall when you're going to hang on something.
This is a high definition. It's not. It doesn't look like that. The real one doesn't look that way. Okay. That's for you to see the different parts of the implant. So you would have to see what the doctor is showing you, asking them about the metal. It's not a heavy metal. However, it has a really strong affinity to the bone, the material that they use. I mentioned nickel titanium, and that's what I know the implants are. So you just have to know how the body responds to this. It actually has a serious affinity to the bone, or the bone has an affinity to this thing. It will literally wrap and entangle itself onto this thing. And because I've seen it before, you have to just look this up, because I cannot tell you all my experiences, but I want you to be able to know how to look. Like, how would implant affect the body? Is it something that you want to do? This is why personal research and talking with the doctor or the provider about your treatment plan is so important. And this is why I show you the different options of what you have. Okay? All right, then that is going to be my last question, because I'm so late for my group. Go ahead.
One, I wanted to get my question. Two, I think the host wanted me to explain what I experienced with the root canals. But the first thing is that even with the partial denture, though, would that also impact your face, the structure of your face?
You sound a little muffled, sis.
Pull out. I'm sorry, I'm trying my best. I don't know what's going on. Can you hear me better?
Yes, much better.
Hello?
Yes, I can hear you better.
I said, well, I want to know how will pulling out my incisions on the number 24 and 25, and I already pulled 26 because 26, the root was actually damaged during the apicoectomy. So they wanted me basically to do another root canal. I said, no, I'm pulling the tooth. The teeth were actually healthy. It was the root that was irritated. I was like, no, I'll pull them out. It's annoying. I'll pull it out. But anyway, what could happen if I pull those 24 and 25 out? What could happen to my face, without those teeth? You were saying that the teeth need to kind of like be on top of one another. So that was my question to you.
Very good question.
And how would
good question.
And how would if I chose to go for the partial, how that impact the structure of my face?
Okay, good question. And I absolutely love it, because when your teeth is pulled, what happened is, can you see the picture on the screen and my arrow this time?
Yeah.
Okay. When you pull the tooth, what happened is the alveolar bone is what gives our face shape. And when somebody loses their teeth, like all their teeth, their face like sucks in, okay? Because it now goes down to the basal bone, because you don't have a tooth there or teeth there. There's no need for the alveolar bone that gives the face a shape. So what happens when you pull, this is number 24, this is number 25, and this is number 26. You're gonna have a space in the front of your face right here without any teeth. And your lip is going to actually suck into that space. So you're going to see that sucked in stuff on your face. When you do a bridge, you see this partial, not bridge, you see when you do this partial denture, should you decide to maintain number 26, you don't want to shave down 26. 26 is perfectly natural, and I don't want to lose any more natural tooth structure. You don't want to take down number 23 either to put a whole 5-unit bridge there. Okay? And that's probably going to be too much of a bridge, 5 units, when you go to bite down. Okay, that biting force is going to be too much for that big of a bridge. So if you do a partial denture, they would do it just like this on the screen, but instead they will place the 3 replacing teeth will be at the front, and they'll just anchor it.
But how that impact my face? I mean, will it help?
Yes.
Bone. Yes. I mean, like my face structure.
No. Hold on. Everybody, I just need to pause for a second. Sister Natasha, can you pause for like maybe 30 seconds for me, please? Thank you.
To keep it in place. To keep it in place. Okay. By the way, initially I thought he's going to charge me $5,500. It was actually $7,500 for the apicectomy. I paid cash, and the whatever else. Anyway, my teeth were still bothering me. It's still hurting me. A month after, I got a rash. It would come and go. I went to get a cleanse in Kentucky, and that helped me for a little bit, but it came right back. The rash on my face now, on the side of my neck. It's going down into my breast area. I've also checked my blood work. These doctors are a mess. My doctor told me, "Oh, you're healthy, you're healthy." Recently I got a blood work. I said, "Sir, I want to see my blood work, please." So I came in. He said, "Oh, you're fine." I said, "Well, no, please circle my vitamin D, circle basically my lymphocytes." I realized there was an issue with lymphocytes because for the last couple of years, I found out from another doctor. He said, "Top slots, and you know your lymphocytes are really high." My lymphocytes were high and my white blood cells were low. And I got the blood test about 2 weeks ago. And again, my lymphocytes are high. My white blood count is low. That means I'm fighting an infection. But yet, the medical doctor says I'm healthy. My dentist says I'm healthy. But you know, I'm also having pain in my teeth, pain around my teeth, the same teeth that I ate to me. I'm losing bone. My mouth looks like I want to say 60-year-old. I'm 47 years old. Not the entire thing, but at any rate, though, I'm having headaches, migraine headaches. In addition, I had an MRI done. There was indication of small vein disease. The plaque bacteria from your teeth can go into not only your heart, okay, can also travel into the veins of your brain and cause Alzheimer's and other cognitive decline. So my thing is this: had I known about the new canal, I would have never gotten it. So you can, and I'm getting new canal because of, yes, poor health clean, but also you can get it because of an accident. Unfortunately, my son had an accident and he got 3 root canals. Did not know that was going to be a problem. Right now, he's not suffering at all, but I know those have to come out. And number two, when you have people telling you nonsense, I was, leading you to get a root canal when your teeth were healthy. So I'm just saying, be careful, my brothers and sisters. You have to really do your research. I didn't do that. I needed to get some, a third or second opinion. Do not run to get a root canal. They're not healthy because reality is that when you have a root canal, the lymphatic system that used to go in there that helps to go through the blood and through your blood as well, it's not going through those teeth. They're not being cleansed. Every tooth in your mouth is an organ that's linked to your bloodstream that impacts the entire biological system. I am suffering right now. An infection right now that I have, I can't even get rid of it. So I'm just holding off until June. So I'm a teacher. I have some things I'm gonna have to do until June. I'm gonna take the teeth out, but I'm gonna be missing 2 teeth. I've lost one other tooth because it was next door to it, and it was infected impacted because of the apectomy. It's really been a serious nightmare for me. So I'm just admonishing you, please, if you can, avoid root canals. They're not healthy for you. They cause systemic disease. There's also a video called Root Cause that was banned from Netflix. It explains the work of Dr. Price, who was the head of the American Dental Association in the 1940s, and he basically did 1,000 experiments on teeth, on root canal teeth, and every single one of them came back infected. There's no way you can clean out 3-5 miles of tubules. So each tubule has tissue in them. And so when there's no blood flowing and they're cut off from the root, the blood supply, they start to decay. The root canal reminds me of a Roman torture, a method they used to use. It's called the death bride, where they take a live human being and tie them to a dead body. And after a while, that dead body will cause the live human being to actually, their body to decay. Death and life cannot coexist. There's no way. It's impossible. Thank you.
Okay, I want to share some things. I think that's very, very sad to actually have to go through all of that. Okay, and I am very sorry to hear that, and I wish that more people who would do exactly what I'm doing, because having been a nurse and seeing what goes on with people and knowing that there's a dental connection with it, I'm surprised that it's not being talked about a lot more about dental health. Like I said, having gone through a lot of medical missionary training, and I'm not down talking medical missionary trainings, but I really do think that dentistry, dental health needs to be included in a lot of them, and it's not just on a surface perspective. It needs to be dealt with in depth. Every single thing that you just mentioned, Donette, I don't know if you heard the beginning of these presentations, but I will highly encourage you to go back and listen to it. But we talked about everything that you talked about, okay? As far as the heart and everything else, okay? The other thing is, I'm familiar with the root cause, but they are the ones that actually promotes the meridian and the electrical examination and everything. You can naturally reset your body's electricity naturally with food, as opposed to the apparatuses that they use that is associated with traditional Chinese medicine and spiritualism. So just be mindful of that.
No, I'm aware, sister. I'm aware. But I do know that what he was experiencing for us physically, that I was, and people think also that I'm a hypochondriac. My mom's a nurse. She thinks she's not a dentist, doesn't know about the health message. She thinks I'm a hypochondriac. Like I'm crazy. I'm imagining in my mind.
You're not.
I'm like, but my blood work says, and even the doctor wanted to push me out his door. Said, "No, sir, please show me my blood work." They called me and said, "Oh, you're fine." No, I'm not fine. Let me see my blood work. And lo and behold, again, and he didn't just address it. When you have a high lymphocyte reading, you're fighting an infection. You have a low white blood counts. That means your body is being, exacerbated by it. It's a mess, and it's hard to sue because the root canal was done in 2016. But usually there's like a 2-year basically statute of limitations. Now, with this other doctor who did the apectomy, knowing those 2 teeth were diseased, I'm going to get my money back. I have 2.5 years to go back and at least get the money back by going to showing information regarding my issue. So I'm going to do a thermography this week, get that done, and I'm going to see some other doctors to see if I can get documentation that what he did was not appropriate.
Okay, you have to now go ahead and do all of that things in the thing is, how you approach is going to be your decision. But right now, based on the health status of your whole entire body, your priority at this point is to get the offensive organ or part fixed, either by extraction and then detoxing your body and then reestablishing your health. Because these are things that traumatizes the body, not to mention the materials that are used that could be toxic to the body. And then you have on top of that, people telling you that you're a hypochondriac, which causes your brain to release negative chemicals throughout the whole entire system. It is an absolute chaotic environment that your body that is in right now that is not healthy. And so my encouragement for you is to go and just give me a phone call. Just call me. And that way we can work on that together. So the other thing is awareness. If I can get this out to every single medical missionary, I am working towards that because there's a lot more that I have not shared.
Right. And I was saying that too. I'm sorry, because I went to Kentucky to go to Red River. They're a great facility. And I said to them, you know what? You need to put this on. This should be on your questionnaire. Do you have a root canal? Because anything you do will work only temporarily until they can pull out the root cause. Because I got a cleanse in October, in August. And now my body's all dirty again because it's dumping stuff into my bloodstream. I feel really sick. I'm getting migraine headaches, everything. And I have other infections that I can't fight off. It will shut down your immune system. It was your body's fighting to keep you fighting to run to that area to keep that area from blowing up. And so every other area is being ignored because of the cells are rushing to keep that thing stable. So it's just a horrible mess. I do not like root canals. I have my son has 3 root canals. Out of ignorance, I didn't know because he got into an accident when somebody knocked him out playing basketball and it hurt his teeth. And I didn't know. But even him, I just really want to help to get this rectified. I think also before the system basically transfers over to CBC, whatever, we need to get ourselves taken care of before the system crashes, because they're going to be watching. And in the name of carbon footprint, they're going to be telling folks you can't fix your teeth. I see that coming right now.
Okay. So, sis, whenever you have a time you want to give me a call, you do that. But Natasha, I am pretty much finished. And definitely we should, Sister Veronica, pray for everyone on here because it is becoming more complicated to find answers to things because of the amount of information that are out there. I don't know if that makes sense, but you have to know now how to navigate your way through information and stay on track. Does that make sense? So
yes. Sister Camille, what is your phone number?
I just put it in the chat.
It's in the chat? Okay. Thank you.
Here, let me put it again.
I've also put parts 1, 2, and 3 in the chat. And if you would like to join our WhatsApp group, I've put the link to that in the chat as well as the YouTube channel. So that's another place where you can view the recording. But I'd like to thank everybody for your questions, for your participation today, and most especially Sister Camille for sharing your knowledge. Any last words before we close, Sister Camille?
No, I don't have any more. If I add anything else when I do, because I'm going to continue doing this research to make sure that I can address these things, understanding that I'm also a nurse. I'm familiar with the medical side as well. So just make sure that, I just want to make sure that, say that again?
Which country are you?
I said I'm also a nurse.
Yeah, I know, but I see 509. This is...
Oh, Dr. Smart, you're going to have to just call me because we're recording.
Okay.
So I don't have anything else, but I'll definitely, once I get any updates and stuff, I would definitely do my best to get it out to people.
Okay.
Thank you.
Thank you so much.
You're welcome.
You have been a wonderful job.
Amen. To God be the glory.
Heavenly Father, I thank God for Sister Camille and her knowledge and the way she is willing to share and link the various factors together. Lord, we pray a special prayer over Sister Donetta, who is in the midst of restoration and healing. And for each and every person on this call, that we take this information and apply it in our lives and share with others. Lord, there's nothing that is too great for you, and we are just putting all of this at your feet. Lord, pray for the forgiveness of our sins and trust in you and your way, which is perfect. Lord, of these and all the mercies we pray in your precious, most heavenly and majestic name, thy will be done. Amen.
Amen.
Amen. Have a good day, everybody.
You too. Thank you.